So the digital divide is really the gap that exists between individuals that use technology and those that don't use technology. So we often talk about those that are digitally included and those that are digitally excluded as well. So in terms of older adults, we know that there is an ever-growing number of older people that are using the internet and social media. So over the last decade, the number of older people that are using the internet and social media has grown rapidly. However, despite this growing number, there's still a gap between older people, typically those over 65 years old, and younger generations using the internet and social media as well. So, for example, the Office for National Statistics in 2018 reported that only 27% of older people over 65 years old in the UK were using social media compared to 96% of those aged 16 to 24. So the gap between generations is still large. But it's important in this respect not to consider older people as one homogenous group. Older people use technology in different ways for different reasons, move in and out of technology use, and have very different experiences of technology use as well. So I think often, when we talk about older people and using technology, they can be kind of classed as one group of people. And of course, this is far from the case. And also, whilst age is one of the factors that does increase the likelihood of digital exclusion, it's not the only factor. There are multiple factors that can lead to digital exclusion, including low socioeconomic status, low education levels, gender, with females typically being more digitally excluded than males, and as well as worsened health status and disability as well. So I think with the digital divide, with digital exclusion, it's really multifaceted and complex, with all of these different factors and intersectionality of those factors impacting the digital divide as well. Previously, digital exclusion was more so seen as issues with access, so those that were digitally excluded were those that didn't have access to digital technologies. But it's not as straightforward as this. And now we look typically at three levels of digital exclusion. So access is being one of them, but it's also around skills and usage as well as the tangible outcomes that people see for the use of technology. So within our study, the skills and usage was really important. What we found was that people that were using technology for social connection, even regular users of technology, were still experiencing multiple biopsychosocial barriers to this use. The physical barriers were around dexterity issues and eyesight problems primarily. Psychological barriers to the use of technology included confidence. So that was around their own self-efficacy of using technology. Some people felt that they were novices, they weren't particularly technology minded, or they lacked patience with technology. And some were also fearful of the use of technology, worried that they would break devices or do something wrong that they couldn't fix. Or they were also worried about privacy and misinformation as well. So there were cultural differences in the way that people use social media. And this was often a barrier to using that form of social media, particularly, if people thought that social media tools were confrontational, people were sometimes argumentative or politically driven, for example. That was a barrier to using that technology. Finally, as well, it's around tangible outcomes and for people to know how using the internet, how using technology can actually benefit them. Not everybody chooses to use technology, and absolutely fine. I think another issue is making sure that everything's not always online, so that those people that are digitally excluded or that choose not to use technology also have some options for services as well.
We know that COVID and the lockdown period has had a huge impact on social isolation and loneliness for many. There is a difference between social isolation and loneliness, though. Loneliness is thought of as the subjective experience and is defined as the discrepancy between the number or quality of relationships a person desires and those they actually have. Whereas social isolation is characterised as an objective state and considers the frequency of social relations and a person's social network. For many, their sole communication will happen online. I'm sure that more people than ever will be really embracing technology. And perhaps there'll be a bit of a love-hate relationship there given the circumstances. But at least it's something, and it's a way to stay connected even if it's not perfect. The participants in our study viewed technology as a welcome tool, but it would never replace face-to-face conversations. However, I think it's important to remember that not everyone will have access to technology during this time, and there are a few issues to unpack around the digital divide. Firstly, there's a digital divide between those able to access technology and those unable to access these tools. But there's a further element to this, and this is when people do have access to these tools, but they still continue to experience barriers to use. It's simply not as straightforward as those who do use technology and those who don't. Now that we're all heavily reliant on technology, it's so important to remember that not everyone can get online and to be mindful of this. Clearly, we're not all equally affected by the pandemic, and those without access to technology could be struggling with isolation or feelings of loneliness. It can be so easy to forget that we're not all in the same boat. For many of our participants, and I suspect many people in general, they rely upon their social networks of family and friends to help setting up and to provide continued support with using this technology. If you're someone who's socially isolated or lonely, then you may not be able to rely on this support. Likewise, if you're not that comfortable with technology and would benefit from help, then feeling like you've got no support if something goes wrong could be quite nerve-wracking. I think that the pandemic has really highlighted inequalities for so many people. We must remember that this new digitally centered world isn't achievable for everyone, and we need to make sure these people aren't left behind. So our research study was done before the pandemic, but we feel as though our findings translate to the current situation. Our research suggests that family and friends being dispersed around the country is a real catalyst for getting online. So it seems really likely that during this period, many more people will be getting online and trying out new methods of communication. When thinking about digital exclusion, there are three elements to consider, and that's access, skills, and tangible outcomes. I know for both Gemma and I, our days are now filled with work meetings over Zoom or Teams. For me, I'm spending a lot more time on FaceTime, chatting to family and friends. We both already had access to these technologies, but certainly using them a lot more than ever before. However, for people that don't already have access to this technology, it's likely that they still don't have access. Likewise, for those hoping to improve their skills in order to fully engage with their technologies, this may have been difficult during this time of lockdown. But it's certainly not all doom and gloom, and a number of organisations are tackling this issue of access during the pandemic. Devices.now is a fantastic initiative by the Good Things Foundation, and they've targeted digitally excluded households without access to the internet and provided them with tablets, SIM cards, and even the support that goes alongside using them. Now, this isn't something that Gemma and I are involved with, but we both think that it's a brilliant initiative and was worth mentioning in the spirit of being positive. So while access and skills may have not changed, what might have changed are the tangible outcomes. A lot of people perhaps don't feel the need to use the internet, but throughout this time of lockdown and increased reliance on the internet, perhaps more people are understanding the merit and need for the internet now. For example, my nana's had a smartphone for a little while, but only engaged minimally with it. But over lockdown, she started using WhatsApp, and we've been sharing photos of the different things we've been baking, and it's been really nice. She's also made a few video calls, so it's been great to see her embracing technology in a new way. It is obviously really hard not seeing people in person, but it has really upped the amount of daily digital communication I'm personally having, and I think it'd be fair to say many people are the same. I'd like to think people around the country are making more of an effort to stay connected and to look out for one another. There are a number of barriers our participants reported, and from our data, we've developed a biopsychosocial model which captures both the barriers and facilitators to use of technology for social connection. I'd just like to point out as well that our participants were regular technology users, and yet they still experience these problems. So when thinking about barriers, it's much more complex than talking about those that can and those that can't. Some of our participants talked about having low self-confidence in using technology and perceived themselves as not being technology-minded. So while these participants did use technology, they felt as though they were novices, and this perhaps restricted the ways in which they explored and experimented with new technologies. A number of our participants were fearful that they would break the devices or do something wrong on social media that they couldn't amend. Similarly, our participants commented on issues surrounding privacy, and this was a barrier in using things like online banking, online shopping, and even social media. Some participants experienced physical barriers. Some reported the text on their phones being too small to read, or the buttons being too small and therefore difficult to use. This is where issues of design come to the fore, and to remember that design for all is very important. Cultural issues around communication styles also impacted the way older adults use social media. Some were active users and posted a lot, whereas others were more passive and mainly read posts from others. Some participants mentioned that they found social media off-putting because of how others communicated, perhaps posting offensive, political or mean comments. Finally, something that was hugely influential in getting participants initially started with using technology and was important for the ongoing support and help with the devices was an individual's social network. For many, without this network, they wouldn't have received the device in the first place, as they were often given as gifts. Without existing social networks, they wouldn't have gotten started with it, and their family and friends often helped with the setup and showed them how to use key features. And importantly, without this social network, they wouldn't have had support to keep using it. When considering the importance of existing social networks, this is where issues of social isolation and loneliness come to the forefront. For those who are socially isolated, who can they turn to for support?
So we know that loneliness is a subjective experience. So loneliness is the discrepancy between the number or quality of relationships that a person has and that they desire. This is how it differs to social isolation. Social isolation is more objective and it focuses more so on the frequency of social relations and a person's social network as well. So the research often shows that social connection is considered as one of the core reasons for online activity. However, there are a few things to think about this when looking at the relationship between digital engagement and loneliness as well. Firstly, the findings linking technology and loneliness are still lacking, and a lot of the evidence is inconsistent. Some show that use of technology reduces loneliness, but other research doesn't show this relationship either. The second thing that we've got to consider is digital exclusion. And it's important to look at the inequity of using digital interventions to reduce loneliness when not everyone has access, skills, or wants to use the internet either. Using technology isn't a suitable intervention for everyone, and therefore it shouldn't be the only intervention that we consider either. We used a national survey in which 400 respondents across the UK completed. And our findings found that individuals that identified themselves to be neither lonely nor isolated used technology, and that includes digital devices, social media, and video communication tools, significantly more often than those that were either lonely, isolated, or both. Now, one of the limitations to this study is that we don't know the relationship between those things. We don't know if loneliness or social isolation had an impact on technology use, or technology use had an impact on loneliness or social isolation. So I think that's kind of my concern for interventions that specifically use technology to reduce loneliness, is that we just don't have the evidence there for that yet. But hopefully in the future we will have.